Why does chemotherapy cause hair loss in cancer patients? Have you ever wondered why chemotherapy causes hair loss in cancer patients? It's a common concern, and understanding the science behind it can help ease some worries. Chemotherapy is designed to target rapidly dividing cells, which is a hallmark of cancer cells. However, it also affects other healthy cells that divide quickly, like those in hair follicles. When chemotherapy drugs enter the body, they can damage or kill these hair follicle cells, leading to hair thinning or even complete hair loss, known as alopecia. Typically, hair loss begins within 1 to 3 weeks after starting chemotherapy. It can affect not just the hair on the scalp but also eyebrows, eyelashes, facial hair, and body hair. For many patients, this hair loss is temporary, and hair usually starts to regrow after treatment ends. However, in some cases, especially with certain chemotherapy regimens, hair loss can be persistent or long-lasting. The reason for this hair loss lies in the way chemotherapy affects the DNA of hair follicle cells. It disrupts their normal cell cycle and can trigger apoptosis, which is a form of programmed cell death. This disruption interferes with the hair growth cycle, causing hair to fall out. Additionally, factors like oxidative stress and changes in cellular signaling can further contribute to the damage of hair follicles. For patients dealing with testicular cancer, cervical cancer, and other reproductive cancers, chemotherapy regimens often include drugs known to cause hair loss, such as taxanes and cyclophosphamide. This side effect is considered one of the most distressing for many patients in these groups. Currently, the only method approved by the Food and Drug Administration to help reduce chemotherapy-induced hair loss is scalp cooling. This technique works by constricting blood vessels in the scalp, which reduces the amount of chemotherapy that reaches the hair follicles. However, it is not suitable for all patients and has about a 50% success rate. Other treatments aimed at promoting hair regrowth after chemotherapy, like topical minoxidil, photobiomodulation therapy, and platelet-rich plasma injections, are being researched but have shown limited effectiveness so far. In summary, chemotherapy causes hair loss because it inadvertently damages rapidly dividing hair follicle cells while targeting cancer cells. This effect is common among patients undergoing treatment for testicular, cervical, and reproductive cancers. While hair loss is usually temporary, it can sometimes last longer. If you or someone you know is experiencing chemotherapy-induced hair loss, it's important to discuss management options and expectations with healthcare providers. They can offer personalized advice and support to navigate this challenging side effect.